Hello, everyone. This is Dr. Dan Lieberman, MD. I'm the medical director here at the channel. And if you've got knee pain, you came to the right place. I'm going to give you in this playlist all the information you need to get rid of your knee pain once and for all. And it all starts with you. What you need is a winning game plan. So let's get into it. Look, knee pain is horrible, right? It's there from the moment you step out of bed, your very first step. It's made worse by everything you do all day. And then the truth is, the very worst part of all is all the stuff that you cannot do anymore. I mean, if you remember when we were young, your knee looked like this picture over here. On your thigh bone at the end, you have this beautiful, silky, smooth white cartilage in the knee joint, two big, soft, cushiony meniscuses on the leg bone to absorb any kind of shock, and then these thick, healthy, strong, young ligaments. Like this is the backside of the anterior cruciate ligament. Unfortunately, as we age, we kind of start to have knees that look more like this. This is a picture of arthritis. And here you see the cartilage is now pitted and degraded by inflammation, which is inside the knee joint, as well as in the fluids. In fact, 20% of Americans have osteoarthritis of the knee. That's 1 in 5 of us. So you may be miserable, but you are not alone. A lot of people have it. You know, the thing about having knee pain, no matter what age you first get it at, is it's kind of frightening because you think to yourself, well, can I really live like this? Do I want to live like this? I always say that if you combine blue and red, you get purple. And just as certainly, if you combine pain and fear, you get depression, especially when you have chronic pain, especially as time goes on. And as a matter of fact, 40% of us with knee pain have never had any kind of treatment. Isn't that incredible? 40% no treatment. Our healthcare system is so fractured in the way that it works. The remaining 60% that do get treatment, in my experience over the last 30 years as a doctor, is a lot of people get the wrong treatment. And a lot of people who get the right treatment actually get it at the wrong time. They've been miserable for years when they could have been treated earlier. Well, I'm here to tell you, and I think the most important thing today is this. It is not normal to have knee pain. You do not have to live like this. The answer for you is going to depend on your situation, and everybody's different. But I do want to start out by telling you a few things which we know are not going to work. What are the 3 things which you should not rely on or you should not do? Well, the first one is pills. Now, don't get me wrong, non-steroidal anti-inflammatory drugs like Aleve and ibuprofen are our very first line of defense for osteoarthritis and other types of knee pain. But these drugs are dangerous. The more you take them, the more dangerous they become. After 3 weeks, there's a real risk that Aleve and ibuprofen and all the other NSAIDs will give you ulcers. And those ulcers can cause GI bleeding, and that GI bleeding can kill you. There's 3 other ways that these seemingly innocuous over-the-counter medications can actually kill you. One is by causing kidney failure. Another is by causing a heart attack, and the last is by causing a stroke. So look, again, as a medical doctor, non-steroidal anti-inflammatory drugs, I'm not saying never use them. I'm saying they're part of the puzzle, but they're certainly not the whole picture. Well, what else is there? Exercise, right? Everybody loves exercise. That's got to be good for you. Yeah, in a way, but if you think about it, especially if your problem is arthritis, the more you move your knee, the more you further damage the cartilage. There's literally thousands of studies on arthritis for the management of exercise, for the management of osteoarthritis pain of the knee. And our good friends at the Cochrane, who are trusted to do meta-analysis, to do good scientific analysis on all of this confusing information, have studied exercise for arthritis of the knee. And the Cochrane people came back with, yeah, it does reduce knee pain. People report a little less pain when they do consistent exercise. If you stop doing it, the effect wears off. It's not that strong an effect. It's moderate, mild to moderate, but it's not enough to make a functional difference. Probably not quite as strong as NSAIDs, but there's definitely a role for arthritis. It's just that it's not exactly going to be a curative role. Well, if the answer is not medications and it's not exercise, then what are you going to do? I think what a lot of us would do at this point is turn to an expert. Let's find, this is kind of what I call the knight in shining armor. And, having spent most of my medical career as a surgeon, can't say I'm opposed to it, but who's the right doctor for you? I mean, I've got 36 of them on my medical staff at the surgery centers. I've got surgeons who are fellowship trained in doing joint replacement. I've got surgeons who are fellowship trained in sports medicine. They do the arthroscopic repair of not only the knee but the shoulder. So they'll clean up your meniscus or repair your meniscus or fix the torn labrum in your hip or do an anterior cruciate ligament reconstruction. And I mean, there's literally, do you need an MD or a DO? Are you really more on the level of a chiropractor, or is the way to go for you actually to be treated by an orthopedic surgeon? If it's an orthopedic surgeon, is it a sports medicine orthopedic surgeon, or is it a fellowship trained joint replacement surgeon? So you need to be the quarterback of this team. You need to be the person who has the information which allows them to know what to do, because nobody else knows you like you do. Look, don't get me wrong, there is a plan. All of our doctors here at Phoenix Spine and Joint follow some version of this protocol for the treatment of knee pain. So there's everything from steroid injection to arthroscopy to hyaluronic acid, that's Synvisc injection, strength training manipulation modalities. These are done by chiropractors or physical therapists, all the way up to robotic partial or total knee replacement, robotic assisted. You know what you don't see on this, by the way? You don't see anywhere on this protocol, give up and don't do the stuff that's important to you. You don't see people crying in their room and becoming frustrated and short-tempered with their spouse and family, because that's not part of the protocol. We do have a protocol and it does work, but there's more to it than meets the eye, and you really have to be the person who is, again, quarterbacking for you. I've been a medical doctor for 30 years. This is my 31st year. And I'm no longer a surgeon in practice, but in the course of my career, I've helped literally tens of thousands of people overcome spine and joint pain to live happier, healthier lives. And even though everybody's different and everybody needs an answer to their own problem, at the end of the day, it really comes down to two things. And the two things are: identify the problem as specifically as you can, and then find the doctor you need to fix it. Find the doctor you need to get the least invasive and safest treatment for the problem. But again, there's nobody who's going to quarterback this but you. And the range of things you need is literally all over the map. I mean, it could literally be as simple for you as changing over to an anti-inflammatory diet. It may be that you need an injection. You have mild to moderate arthritis and a steroid injection isn't going to do it. You have to choose whether to take the Synvisc injection your insurance will cover, or to spring for a self-pay for a very expensive stem cell injection. We can help you with that. If the problem is your meniscus is torn and it needs to be cleaned up, or your anterior cruciate ligament is torn and you need a reconstruction, then you need a arthroscopic surgery. And we'll introduce you to some surgeons and give you a sense of how they do what they do, who are fellowship trained in sports medicine. Alternatively, maybe it is arthritis. It's not just mild to moderate. It's not just severe. It's to the point where you need a new knee. And if that's you, we can help with that as well. We will introduce you on the channel to some really excellent joint replacement surgeons and get you set up with what you need to make that work. Well, we're back where we started, you with your knee pain. And what I'm here to tell you is on this playlist is all the information you need to get your game plan together and go and execute a series of moves which are going to get rid of your pain once and for all. You have to educate yourself. I think the easiest way is just follow these videos through. The next video is for people who have had pain that's less than 3 weeks old. If you've had pain for 3 months, 3 years, 30 years, either skip it and go on to the next one after that. Next one's about, well, have you had an MRI? If you haven't, do you need one? If you have had one, next video tells you how to read the report. Lets you go through and figure out what to do and helps you figure out what doctor you need along the way. It's complex. There's no question about it. And it's medicine. This is not motorcycle mechanic school. It's the human body. It's very complicated. At any time, if you give up and need help, you can contact us here at Phoenix Spine and Joint. Our highly trained staff are waiting to help you. You can also go to our website, phoenixspineandjoint.com, look under the knee menu, and there are tools and interactives to help you learn more about what is the right treatment for you. A lot of this same material is there where you can go over it and read it. And finally, if you know what you want or you're just too frustrated to keep on trying, don't do anything, call us. We can help and we'll help you get better. It's been a pleasure having you today. Good luck with your journey.